My name is Vanda Lennon, and I am chair of the SIG on Autoimmune Neurology. This SIG was initiated 4 years ago. Initially started out to be neuroimmunology and demyelinating diseases. However, the field of autoimmune neurology is expanding so quickly. I thought it would be better going forward. This is my last year to separate multiple sclerosis and related diseases from autoimmune neurology. So our SIG going forward will be autoimmune neurology. What is autoimmune neurology? These are disorders that have a specific antigen as target of the autoimmune disease. The targets have been either identified by marker autoantibodies in the patient's serum or spinal fluid, such as neuronal nuclear or cytoplasmic antibodies, or antibodies directed against cell surface synaptic proteins, or they are clearly keeping company with other autoimmune diseases, although no specific marker has yet been defined. The companion disorders of thyroid disease, type 1 diabetes, for example, and they are responsive to immunotherapy, traditional immunotherapies, antibody-depleting therapies, immunosuppressant drugs. None of these criteria are met by multiple sclerosis, which I'm not denying is an immune-mediated disease, but it's certainly by no means proven to be autoimmune. The autoimmune neurological disorders that have marker autoantibodies directed against the intracellular compartment, nuclear and cytoplasmic, are actually affected by cytotoxic T cells, and the marker antibodies are in fact surrogate markers for these T cells. The T cells are recognizing peptides derived from the intracellular proteins that the IgGs define, and those peptides in an inflammatory environment upregulated onto the surface in the context of MHC class 1 molecules, and this is what the T cells are seeing. The antibody-mediated diseases, those affected by circulating or intrathecally synthesized autoantibodies directed against plasma membrane proteins. And these proteins thematically are synaptic proteins, but the concept of the synapse in neurology is extending way beyond the neuromuscular junction, where it started with myasthenia gravis, Lambert-Eaton myasthenic syndrome, and the presynaptic elements involved with voltage-gated potassium channel complex, but through the autonomic nervous system and to the central nervous system, not only neuronal synapses, but synapses between astrocytes and oligodendroglia, astrocytes and capillaries, astrocytes and neurons, astrocytes and astrocytes. And these disorders that are synaptic respond to antibody-depleting therapies, provided they're initiated within the first 6 to 12 months, some of them longer, but those that are destructive via complement activation and via failure to clear glutamate from synapses, for example, because it's physically coupled to the target antigen in neuromyelitis optica, the aquaporin 4 water channel. Those disorders are responsive to IgG depleting therapies, but they usually require long-term immunosuppressant therapies. In today's program, as leaders in the field, we have Dr. Joseph Dalmau from the University of Pennsylvania and the University of Barcelona talking about the diagnostic utility of synaptic autoantibodies and interpretation of seropositivity or spinal fluid positivity. We have Dr. Sean Pittock from the Mayo Clinic, covering the whole spectrum of neurological autoimmunity from the cerebral cortex to the colon, as he refers to it, which is actually the enteric nervous system. This is something we're expecting the gastroenterology world to wake up to, but they haven't yet. And so he'll be covering constipation and, of course, intractable nausea and vomiting, which can occur as the heralding symptom of neuromyelitis optica in 12% of patients. Then we'll have Dr. Bogdan Popescu from the University of Saskatchewan, comparing the immunopathology of neuromyelitis optica with that of multiple sclerosis and updating newer findings, of which he has been the forefront. And then we'll have Dr. Christopher Klein from Mayo Clinic in Rochester talking to us about the newly described autoimmune pain syndrome associated with voltage-gated potassium channel complex autoimmunity. And this is something that is very new, and it will explain, we don't know yet what percentage of chronic pain syndromes, but these are patients who've not formally been able to be controlled by anything less than narcotics, and they respond beautifully to intravenous prednisolone therapy. So Dr. Klein, following Dr. Klein, we will have, I think at last count it was 6 presentations selected from abstracts with emphasis on junior faculty and fellows. In the presentation, I do think we have one presentation by a medical student. I anticipate that this will be a very exciting program, and based on the last 3 years, it's been standing room only, and I don't expect anything less this year. It's such a rapidly evolving field that this is a very welcome forum, both for the participants and for the audience, to catch up with what is new. Thank you.